is pemphigus? Pemphigus is a rare skin disorder that comes in a few different types and causes blisters and sores on the skin and mucous membranes, the mouth, nose, throat, eyes, and genitals. Pemphigus is an autoimmune disease where the body attacks healthy cells. The antibodies break down cells and fluid collects between the layers of skin, forming blisters and sores. Causes. Pemphigus is not contagious. It is often not known what triggers the disease in people. When someone has pemphigus, their immune system creates antibodies that attack healthy cells in the skin, causing sores and a rash. In some cases, pemphigus can be caused by medicines, but once the medicine is stopped, then the pemphigus will recede. People at risk. Pemphigus is far more common in middle-aged and elderly people. Pemphigus is seen more often in people of Jewish descent. Pemphigus is seen equally amongst men and women. When to consult a doctor? When blisters appear on one's mouth or skin, rapid spread in number of sores, fever and swelling can be an indication of infected blisters, which can become very serious and potentially life-threatening. Someone should seek out a dermatologist or a skin doctor who would diagnose and treat pemphigus. For mouth sores, in some cases a dentist can also provide treatment. Pemphigus vulgaris. Pemphigus vulgaris starts with blisters in the skin and mucous membranes. These blisters do not itch but are painful. Blisters in the mouth can make it hard to eat and swallow. These blisters can lead to bad infections and even cause death if untreated. Pemphigus vulgaris is a more serious form of pemphigus, and treatment for it is essential. Pemphigus foliaceus. Pemphigus foliaceus usually only affects the skin, not the mucous membranes. It causes a rash and blisters that itch but are not painful. The blisters are usually only on the chest and shoulders. Pemphigus foliaceus is far more benign compared to pemphigus foliaceus. This form is far more itchy and is not painful. Other types of pemphigus. Pemphigus vigatans is thick sores found on the groin and armpits. IgA pemphigus is caused by an antibody called IgA, and it creates blisters and bumps much like pemphigus foliaceus. IgA is the least harmful breed of pemphigus. Paraneoplastic pemphigus is a very rare type, usually only appears in cancer patients, and may need special tests to diagnose. Diagnosis for pemphigus. Pemphigus can be difficult to diagnose since its symptoms are similar to other conditions. With pemphigus, often the top layers of skin will come off when rubbed by a cloth or something in the affected area. Blood tests will be taken to find the antibodies that attack the healthy cells, and a biopsy of a blister removed from the skin. In this test, a piece of affected skin will be examined under a microscope to see if it is pemphigus. Treatments for pemphigus. Drugs are used to suppress the immune system from attacking healthy cells. Corticosteroids in the form of pills and cream can be very effective treatment. Immunosuppressant medications that are meant to prevent antibodies from attacking the healthy cells. Rituxan is an injection that kills the white blood cells responsible for attacking healthy cells. Antibiotics will be used to prevent and treat infections from sores. And pemphigus is best controlled if it is diagnosed and treated early. Long-term treatment for pemphigus. Left untreated, pemphigus can cause death, potentially, usually from the infections. Pemphigus is a lifelong condition and cannot be cured. Typically, corticosteroids send pemphigus into remission quickly, and improvement can often be seen in just days after starting the steroids. Healing of the blisters, though, can take up to 8 weeks or longer. Potential complications from pemphigus. One serious concern for people with pemphigus is infections from the sores, and infections have the potential to spread to the bloodstream and can even cause death. Another serious complication is gum disease, which can come from the blisters in the mouth. And certain medicines that treat pemphigus can also have side effects, certainly when taken over long periods of time. Pemphigus in animals. Pemphigus is a disease seen in animals as well as people. 4 types of pemphigus are seen in dogs: pemphigus felaceus, pemphigus erythematus, pemphigus vulgaris, and vigatans. Symptoms and diagnosis in dogs are nearly the same as it is in humans, and dogs suffering from pemphigus will likely have to be hospitalized and then find out treatment from their vet.